Just like all of us, our learners get hurt and have pain as well, but many of our learners are unable to appropriately express when and where they are in pain. So, the first step to identifying pain is to teach body parts. So, what are the other ways to teach body parts to our learners? Hi, I'm Shira.
And I'm Shayna. We're behavior analysts who create weekly content about how to teach children with autism so that they make real progress. And we create shareable resources to make your job just a little easier. Today's topic is all about teaching body parts with the end goal of being able to identify pain. So if you want more videos like this, make sure to subscribe and hit the notification bell to stay updated on new video releases.
I remember having a client many years ago when I was a little bit newer into the field, and he was very young. He was probably about 3 years old. And he suddenly started banging his head at night, and he would bang it on his bed. And his parents were really concerned, and they came to me wanting a behavior plan. Like, what's with this new behavior? We want to address it. He needs a behavior plan. And everybody started getting on board with that. And then we suggested that they take him to the dentist or the doctor. And it turns out that he had a couple cavities in his mouth. And that was really what was making his mouth hurt. And it would get worse at night because sometimes that happens with teeth pain. And that they took care of that, and his head banging stopped.
It's so important to think about medical things and biological factors before treating problem behavior, just as problem behavior for sure. But one of those things, I think about it all the time, is that if our learners don't have body parts, for instance, how can they say, like this hurts or this hurts? And they can't necessarily express pain. And, you look at, body parts and is it a functional program? And, we can argue that, well, maybe knowing, the inside of your nostril and what that, is labeled as isn't functional necessarily in everyday life. But to be able to say my head hurts, or I have a pain on my elbow, or I scrape my knee, that is huge for a learner. So we need to make sure that we're addressing some of those goals.
And I think especially with behaviors, because for our learners that can't communicate, sometimes it does look like, it's a challenging behavior that we need to reduce. And we're not looking at what are they trying to tell us? And are they trying to tell us that something's hurting them? And so it's really important to not let the behaviors cover up some of their, physiological needs and physical needs in terms of what's hurting them. And like Shana said, the first step in them being able to tell us what's hurting them is for them to be able to identify their own body parts. And that's where we start. We start with receptively identifying their own body parts by pointing to the body parts on themselves, on a doll, in pictures. And we use like all the names of the body parts that would be appropriate for the learner. And then once they can receptively identify them, we would go into labeling them as well.
And, there are some learners who are so delayed that they may not understand a receptive label and may not ever get the terms. But that matching component is huge, because if we can print out a real life visual of themselves so that they can at least point to, themselves, point to a visual of where things hurt, then they can at least be able to express it that way as more of a match to sample. But that matching component is huge. So let's talk about, though, the receptive and expressive identification of body parts, because for most learners, that's where we would start. So in terms of starting teaching, you can do this in a very discrete trial way where, you're sitting across from the student or you're sitting beside the student and you're giving instructions, point to this, point to that. Or you can do it in the natural environment and do a lot of doll play, playing with dolls, playing with teddy bears, looking in a mirror. So there's a bunch of creative ways to teach it. But for the purposes of this, let's just talk about a straight up body parts program like you were teaching it at the table, and then we can get into some generalization after.
I think the first thing is thinking about what kind of body parts you want the student to know. Some students can know the difference between a wrist and an elbow, and for other students, it's just arm. And I think you can think about which students just need to know like 10 body parts and they'll be fine, or even 5. And other students might be helpful for them to discriminate more detailed body parts, but it's not the same for everyone. So the first thing is thinking about what your targets are, what you ultimately want your student to be able to know, and then picking a set of 3 targets at a time. So it could be, and trying for those first 3 that you're teaching to be different, like in a different area of the body. So you're not teaching eyes, head, and shoulders at the same time, but you could choose head, stomach, and leg.
Head and shoulders, knees and toes.
You could do that too.
Yeah. Very general body parts to start with, and then you can narrow them down based on how quickly your learner is learning. We also get parents who want to teach their kids private parts, and that is a really great idea as well. Peter Gerhardt has a newer book out, and he talks about teaching private parts to adults, or actually teaching them when they're really young, so that as adults they know what that is, so that they can say, someone touched me here, or I have a pain here, or this is what happened. And that is very important in and of its own right. But for the instances, or for the purposes of this, let's just talk about teaching, your basic body parts: head, and shoulders, knees and toes. Yes, you can sing that song as you teach. But the reason why we typically teach in sets of 3, or even just set of 3 at a time, is really to prevent that overgeneralization. And what we mean by that is that if you are teaching over and over and over again, touch head, touch head, touch head, touch head, well, guess what's going to happen when all of a sudden you say touch shoulders? What's the learner going to do? They're going to touch their head, because they've, that head touching behavior has been so reinforced. And that's what overgeneralization is. So if we can randomly rotate between when we ask for touch head and touch shoulders, then the student learns to discriminate our language almost from the get-go.
And we mix it up. So with that one set, it might be touch your own body parts, and then it would be touch the doll's body parts, or my body parts, or on a picture or in a book. And so you're using lots of different exemplars of what those body parts look like. It's hard sometimes when you get a picture of like a leg and it's attached to your own body, and then you're like teaching the student that that's a leg, but they might not understand what it looks like on a body. So using your learner in terms of the types of pictures and things you're going to use is going to be really important. Real life pictures as much as possible, and just really mixing it up so that you're teaching them with lots of different exemplars.
I'm smiling right now because my girlfriend is in advertising, and she jokes around about severed body parts in ads. And she's like, it's so awful just to see a severed hand coming into a picture when you're trying to do art design in an advertising field. But anyway, with that being said, yes, like Shira said, change it up, use multiple exemplars, and have them point to all of these different exemplars. You can split this up. So if as your teaching steps, your first teaching step can be identifying body parts on themselves. And the second teaching step can be, identifying them in pictures or on a doll. And the third one, or if you've got a learner who can, handle that all at once, teach them all at once. And, being able to point to, a nose on this, on that, and on something else is really important. So sometimes you can just teach it all at once.
And then before moving on to the next set, if your learner has, vocal language, or even on an AAC or some other way that they can then respond expressively to what is this called, what body part is this? So then they're labeling that same set of, 2 or 3 body parts that you chose. So then they're learning to receptively identify them on themselves in pictures and on others, and also label them on themselves in pictures and on others.
And that is huge because, we talk about teaching across operants, and this is what we mean by that, is that, it's not about, okay, well, we teach set 1 and we teach head and shoulders receptively, and then we go on to something else receptively, and then we go on to something else receptively. And then not until they've mastered 20 body parts do we put them into, labeling or tacting. What's going to happen then? The learner's going to say, oh, well, why do I need to talk now? I haven't had to do it before.
And we forgot the set that was taught a year ago.
So we want to make sure that we're toggling back and forth between receptive and expressive all the time when we're teaching.
Yeah, for sure. So once they can also label those body parts, then you would move on to another set and picking another set of 2 or 3. From there, once you introduce more than 2 sets, you want to always be randomly rotating, which is so important because, like Shana was saying, they may forget the things that were taught, and we forget to continue to practice them. So even though they were technically mastered, we don't move on to a 3rd set until we're continually mastering through the random rotation all 6 of them that we've taught, and then all 9 of them that we taught. So we're also reviewing them and practicing them so that the student doesn't forget the ones that were taught previously.
And, now once teaching body parts is mastered, and some people would argue with me and say teaching body parts is never mastered, because once you've taught, 15 or 20 body parts, you can go on to, more select body parts. And yes, you're right, absolutely. But just for the sake of arguments, or for this purpose, once we've taught, the basic body parts, we can now start to identify, or to transfer this over to identifying pain. Because really that's what the goal of this program is all about. Yes, it's increasing language, but also then being able to identify that pain. So, once, kids have those main body parts down, we typically would do this through play. So grab a doctor's kit and really try and play interactively, right? So, I'm listening to the baby's heart, I'm listening to your heart, I'm listening to my heart. Oh no, I hurt my elbow. Oh, look, the doll fell down and hurt, his knee. What are we going to do? And, putting Band-Aids on certain body parts and really modeling that language. Ouch, my elbows hurt. Ouch, my shoulders hurt, and that type of thing.
So then what you're looking for is for the student to be able to do what you're doing and put a Band-Aid on their elbow, and then put a Band-Aid on your elbow. And then maybe you put a Band-Aid on the student's knee and you say, oh, where did I put the Band-Aid? And then they're able to tell you, my knee. And then you can put it on your knee. So they're able to both do certain things with the doctor kit on themselves, on you, and be able to then answer what hurts.
I had a therapist one time. Shout out to my therapist, Rachel. She creates the best materials, and she created a whole set of materials for this doctor's kit program. And she actually had a student identifying body parts that hurt on a doll. But if the student identified, say, the knee, for instance, they point to the knee on the doll. And then she had this visual that was different body parts. And the student would point to the visual of like the knee, and it was a flip thing. So they'd flip up the knee, and there'd be a picture of a Band-Aid, and then the student would go to a drawer that was labeled Band-Aid and get a drawer and put it on the doll. It was so cute. But anyways, you don't have to be as creative as her, but it is awesome to see that stuff.
The full program description of using body parts to teach with pain with the doctor kit is in our membership. But you can go and get just a body parts part of the program for free with this podcast. So go and check that out. Also, we talked a lot about the random rotation and introducing things in sets, which we called the generalization and maintenance of skills. So we have a whole video on that, on generalization and maintenance of skills in ABA. So you should definitely check that out, because that's in a lot of how we program and how we teach a lot of skills.
So in summary, today we discussed teaching body parts to learners through teaching across operants, and we talked a little bit about identifying pain as well, and how that's ultimately our goal. For more information on teaching body parts, click the link in and around this video or in the description to claim your free download on body parts. We also encourage you to subscribe to the channel so that you don't miss any future videos, and leave a like and comment below if you have further questions.